It's like a miracle, really. You got all this pain for months and then nothing. It's just like normal. I love these guys.
That's right. I had the pleasure of doing both of Dan's hip replacements. So with his second surgery, he participated in what's now known as our VERA program, or our Victoria Enhanced Recovery Arthroplasty program.
What we're trying to promote is early ambulation, and we're also trying to prevent some of the side effects of the traditional approach.
The morning I woke up, at being at home, it was like I hadn't had an operation. I walked out to my deck, I sat, I had a coffee. I didn't feel anything, I didn't need a cane, it just was amazing.
We were able to visit a center in Montreal that have been doing this protocol for about 2 years, and I was amazed to witness firsthand at how well those patients were recovering on the day of surgery, and then also talking to the surgeon about his experience and how well his patients were doing.
We did an epidural, and so you're kind of awake while you're freezing up, and yeah, and it went every bit as good, and I had less restrictions when I came out of it.
We can get these patients mobilizing much faster because that residual weakness that the spinal anesthesia used to cause, which prevents patients from walking, is worn off very quickly, within about a half an hour after the surgery.
We're following a lot of the similar steps of their protocol in terms of the pre-medication, some of the surgical modifications, and also using the same type of sutures and dressings that they were using in that program. And so we've adopted a lot of their steps to enable this to happen.
We're almost taking it from a high level to a higher level, and watching these patients literally bending their knees, pain-free, in the recovery room, even in the OR sometimes. Watching Dan walk here, that to me is, yeah, I get excited about it.
To turn around and see this protocol working as well as it has, and not seeing the same levels of pain, not seeing the nausea, vomiting, dizziness, all these complications that we commonly see after a big operation, it's been extremely satisfying for me as a surgeon to see my patients do as well as they have.